Hi everyone, welcome to the Lakeview video podcast series, and I'm pleased today to be joined with LeiRonna Spurlin, who's working with the Ascension House and HPS Addiction Services out of Austin, Texas.
That is correct.
It's good to have you here.
Thanks for having me.
We're really excited to share with folks a little bit about the services that you offer. You represent a transition program called Ascension House, but you also are a trained interventionist as well.
That is correct.
And so before we get into the specifics around your services, let's talk for a few minutes about your background and how you got into the field of addiction.
Sure. I was an executive recruiter most of my career, 20 years. I was laid off in February of this year and decided that that was no longer my passion.
Mm-hmm.
And my husband had started HPS Addiction Services, and I let him know that when I was laid off that I was interested in joining him, and really following that path and purpose and passion that we have to help people. So yeah, that's how I.
So you brought it into the family.
Brought it into the family.
That's fantastic.
Yeah.
Well, let's talk first about Ascension House. What is Ascension House?
Ascension House is an extended care program. We are a high-end 24/7 supervised sober living environment. We have a house manager on staff that sleeps there at the house, and then we also have 2 techs that are with them at all times. So they are highly supervised, and then we partner with a local treatment facility for PHP or IOP.
And this is women only?
Women only.
Okay.
We have 13 beds. Right now we have 7 women in our home, so it's a relatively new to Austin. It's been open since August.
Okay.
And we also offer a chef-prepared meals, in-house programming, which includes big book study, relapse prevention. They do attend some off-site meetings, outside meetings. We do a lot of, just codependency work. So it's a really great program for people that need just, transitioning from a 30-day treatment and need that next step in recovery.
And women are so different in many ways in regards to what they need post-treatment. So it sounds like you're capturing a lot of those services to help them with their early recovery.
That is true.
Which is great.
True, yeah.
So what would the typical female look like that would come into your program?
We love to see people that have some, 30 days, inpatient, but we are open to anybody that may have relapsed and coming straight out of a detox and need that boost and that support of having that supervision and really can focus on, because we take a lot of the day-to-day activities out of the way, like cooking and all of that stuff, so they can really focus on their recovery.
I'd like that.
Yeah.
Wouldn't you like that?
Yeah, I'd love it.
Let's take all that out.
I've seen, I know the type of meals he prepares.
Yes.
And yeah.
That'd be great.
Yeah, it would be great. It would be terrific. And it's a beautiful home too. It's located in an area of Austin called Terrytown.
Okay.
And it's a real, just a beautiful home, kind of an older home, but it's just so beautiful, and the property's just gorgeous. I mean, it's just a really nice upscale kind of home.
Sounds very special.
Yeah, it is. It really is.
So you've talked a little bit about the back end of treatment when people leave. Let's talk for a few minutes about what you do on pre-treatment when you're trying to help people get access to services. So you're an interventionist.
We're both, my husband and I started this company. Like I said, he started it back in October of 2015, and I joined in February of this year. It's just about helping families work with their loved ones to get them to treatment.
Are you doing a specific model? Do you do Johnson? Do you do some other type of intervention or invitational model?
It's more of it's an invitational model, and my approach is coming at the family and the person that needs treatment with love. And we work very closely with the families to prepare them for this, because it is such a difficult time for the family when it comes time for the intervention, and trying to prepare them and really keep them on track. They're so emotional about the process, and we're just there to facilitate.
That's great. That's great.
And then once we get them to agree to go to treatment, then we have the plan in place to transport them to whatever facility has been decided, and get them safely and get them started on their journey.
Great peace of mind for the family
Yes.
and for the client.
Yeah, it's amazing at the end of the interventions to see the peace of mind that is coming. You could see it in their faces. They're so relieved. And one of the things that I typically tell the families when we finished is, now you can rest, you know. And then we also make suggestions about getting involved in Al-Anon programs and that sort of thing, so that as their loved one is in treatment, they're doing something to
their own recovery.
Yeah,
Right.
because it is a family illness.
Absolutely.
It is a family disease.
Well,
yeah.
good. It sounds
Yeah.
like you've captured the full spectrum, which is terrific. If folks watching today wanted to access services and to reach out to you, how could they do that?
The best way to contact me for either the Ascension House or HPS Addiction Services is to contact me on my cell phone, and that number is 210-296-8176.
Thank you, LeiRonna. It's a
Thank
pleasure to
you.
have you in Jacksonville. Thanks for
Thank you. It's
spending time with
beautiful
us.
here. Yeah.
Thanks so much.
Thanks.
For those of you that are interested in learning more about Lakeview Health or need access to inpatient treatment right away, please visit us at lakeviewhealth.com, or you can call us right away at 886-887-0142.